there are three areas of the pharyngeal tissue. One is nasopharynx, one is oropharynx, one is laryngopharynx. I also see tonsils. There is lingual, I'm sorry, this is lingual tonsil. This one's pharyngeal tonsil. And that one's the palatine tonsil. I also see vocal cords in the larynx, the true and the false one. Which one's on top? False. True is on bottom. I see a couple of cartilages. I see epiglottis. I see, you know what that is? It ought to be thyroid. Okay, well, let's continue on here. Here's another larynx model with the tongue. This model is good at showing submandibular, sublingual. It shows our nerves that you got to know for our muscles, the superior and inferior laryngeal nerve. With the posterior view, you can see the epiglottis there. There's two tubercles. One is the cuneiform tubercle, and the other is the corniculate tubercle made by the corniculate cartilage. That's the arytenoid cartilage, and that's the cricoid. Okay, there's the thyroid, and that's the cricoid. That's what we see there. If we look down the hatch there, we see the glottis, which is the space. Now, the things that bound the space are the true vocal cords. This model is the thyroid muscle. That's this muscle right here. That's one of the muscles you got to know. We have to know one muscle on the front is this one, cricothyroid. The one in the back we got to know is the posterior cricoarytenoid. That arrow is pointing to the vocal cord. Okay. That muscle abducts the vocal cords. If we just look at the cartilages we got to know, it's labeled here. The epiglottis, the thyroid cartilage, the cricoid cartilage. And this is the laryngeal prominence of the thyroid cartilage. From the posterior view, we can see the corniculate and the arytenoid cartilage, and the cricoid there, and epiglottis, and So here's the larynx with some of the big bronchi. And if we label it, I like to use this for the carina. Also the primary bronchi, also called right and left main bronchus. Is that the right or the left? That's the right. Remember, it's always the patient's perspective. You can call these secondary bronchi. They're also called lobar bronchi. The colored ones are tertiary or segmental bronchi. This picture is showing the entire respiratory tree, starting from up here. This is a model we have in the lab. I do have a picture of this, maybe in the practical. If you see cartilage, number one, they're trying to tell you they're all bronchi. If you get down to the smaller airways, which have no cartilage, that's bronchial. If you have bronchial down here, this is the end of the conducting airways. So number 5 is terminal bronchial. Number 6 is respiratory bronchial. Number 4 is the entire respiratory zone. Number 7 is the asthma structures. It's little alveolar sacs, alveolar spaces. We have more models of the alveoli, and it's labeled. And they show you bronchus with the cartilage. They show you a bronchiole, note the lack of cartilage. Okay. There's a respiratory bronchiole with the alveolar spaces. They show you alveolar duct leading to alveolar sacs here. And they show you a lot of things. The pulmonary artery carries deoxygenated blood, but they color it red, which I think is deceiving. This is the pulmonary vein, which carries oxygenated blood, but they color it a deoxygenated color, which I don't like, but that's what it is. The little black nets are elastic fibers, and the red nets are pulmonary capillaries. Remember our pleural membranes? This is the visceral one. You don't see the parietal one. It's on the chest wall. Here's the back of that same model, and you can see a better view of the respiratory bronchiole. You can see a bronchiole here, no cartilage. Okay. And these are alveoli wrapped in the pulmonary capillaries. You see the visceral pleural through the back here. And here's a similar model of the same thing. They do show on this one the bronchial artery, just supplying oxygen-rich blood to the airways. It's not pulmonary circulation. Okay. These two are pulmonary circulation. They got it right here. Blue means deoxygenated blood. That's the pulmonary artery, this is the pulmonary vein. If you pay attention to the thickness of the vessel wall, you tell me, do arteries or veins have a thicker vessel wall?
Arteries.
Arteries do, and they do illustrate that correctly. And you can look at that model in this room. If I point up here and you see cartilage, what kind of airway is it? Bronchus or bronchial? Bronchus. So these down here with more smooth muscle, no cartilage, those are bronchioles. This one in particular with alveoli is a respiratory bronchiole. Okay? So that means the ones right before it are terminal bronchioles. Okay, so you can also see alveolar spaces here too, and it's a good model. So I already went over this one. So if you look at the gross anatomy of the lung, this is good for the lobes or fissures. If I put the labels in, you'll see that you can barely see the oblique fissure over here, so don't let it hide from you. You have two fissures, oblique and horizontal, which separate the right lung into three lobes. Superior, middle, inferior. The left lung has one oblique fissure for two lobes, superior and inferior. So I use this primarily for lobes of the lung. Okay, I think it's time for a break. At least I feel like I need one.